Bulaminaka, Fiji. We've previously mentioned that we will be doing statements for most of the times, and then when we had special announcements, we either did it as an announcement or through a press conference. Today we do have some significant events to announce. That's why the three of us are going to do the various components of that announcement today. In addition to the 26 cases that have been announced, that have been reported in my previous statement, we now report 9 new cases this evening. 5 of the cases are linked to the Nawasai Narere cluster, 1 to the Woila cluster, 1 is from the Nawaka cluster and works at the Nadi hospital, and 2 have been detected at CWM hospital. Now, in addition to the Nadi hospital worker, further investigation also revealed that a case announced over the weekend from the Nawaka cluster, who was discovered as part of our screening and contact tracing in that area, had given birth and been discharged from the hospital a week ago. Furthermore, another previously announced positive case had spent significant time as a visitor in the hospital just prior to being positive. All staff and patients currently in the hospital are being tested. In response to these cases, the Nadi hospital will be locked down and services will be relocated. Our chief medical advisor will further elaborate on this matter tonight. As stated, 2 of the new cases of COVID-19 have been detected at the Colonial War Memorial Hospital in Suva. The first detected case is a patient from Lambasa who was admitted at CWM 6 weeks ago. She was swabbed as part of the exit protocol before her scheduled transfer to Lambasa. It is suspected that she caught the virus from either another patient, visitor, or staff during her admission at CWM hospital. The second case at the CWM hospital is a nurse. She developed symptoms and was swabbed and isolated as part of the hospital's existing surveillance program. The nurse worked at a different part of the hospital to the positive patient, and at this early stage in the investigation, no connection has been made between her and the patient or any other known clusters. As an early part of the response to the outbreak in the Central Division, all our frontline health staff had been removed from their places of residence, and they were housed in bubbles in accommodation facilities across Suva. The staff had been separated from their family for weeks on end, and in order to safeguard our essential health services. This staff had been working within a bubble and was housed at the Holiday Inn. The detection of these cases within the hospital will require measures to secure the hospital and its staff and its patients. The existing protocol for weeks had been to isolate every new admission and their carer, have them swabbed and tested before allowing admission into the wards within the hospital. Hospital staff was tested if they had symptoms or if they were residents of an area with the reported COVID-19 cases. Staff in the COVID-19 ward, isolation ward, were tested more regularly with negative tests required before ending their rotation through that ward. Now, in response to all these recent cases, all the patients, their carers, and all the staff at CWM will now be swabbed and tested in order to gauge the extent of any spread within the hospital. This is an estimated 1,200 people who will be tested overnight. CWM hospital will be closed, but we will have emergency services available. We are currently conducting evaluations to determine which areas in CWM need to be locked down and what services need to be curtailed. And we are establishing procedures to keep critical services functioning safely. For the time being, as I mentioned, all emergency outpatient services will cease. All non-emergency outpatient services will cease, including the special outpatient department. The wards of concern are in the east and the west wings, and all these wards have been put on lockdown. These are the acute medical ward, acute surgical ward, Benga ward, and ANZ ward. Emergency services will continue at CWM. The emergency department is functioning, and inpatient pediatric and obstetric services will continue. The maternity ward and the children's wing are still in operation, but all access to these two wings from other parts of the hospital have been closed. The data from the overnight testing will determine how the existing contingency plans will be reviewed and what further measures will be implemented. Thank you.
Good evening. So as just announced by the Permanent Secretary, in addition to the 26 cases announced already earlier today, we're reporting 9 new cases this evening. Just to recap, 5 of the cases are linked to the Navosai Narere cluster, 1 to the Wailar cluster, and 1 is linked to the Nawaka cluster, and he works at the Nadi hospital. And 2 new cases have been detected within CWM hospital. The details of these cases have just been described by the Permanent Secretary. So now we have 302 active cases, with 284 of these cases within the Lami Suva Nosori corridor and 18 cases from Nadi. 2 of the active cases in Suva are considered to be severe. There have been 403 cases since this outbreak started in April of 2021, and Fiji has had a total of 473 cases since detecting our first case in March of 2020. And we've had 167 recoveries and 4 deaths. In terms of testing, 68,609 laboratory tests for COVID-19 have been conducted since this outbreak began in April. And in total, we've conducted 100,000 and 11,479 tests in total since we started testing in early 2020. A total of 2,732 samples were tested yesterday, and our daily average of testing has been 2,664 tests per day. Our average daily test positivity now sits at 1.2%, and we're testing an average of 3 tests per 1,000 people every day. Thank you.
Thank you, PS and Dr. Alicia, and good evening. So reiterating some of the messages that have been delivered earlier by PS. So today is day 44 of the current outbreak. And in terms of the 2 health facilities of interest, so Nadi Hospital is currently closed to the general public. We now have in the hospital, sequestrated in the hospital, a total of 40 staff and 37 patients, including 8 mothers. The hospital team are organizing a roster which will include a total of 90 staff, and they will be rostered over the next few days to look after the patients and will be accommodated at a government designated facility in Nadi while undergoing testing. The testing facility at the hospital, the COVID-19 testing facility at the hospital will continue to operate and will test all swabs, COVID-19 swabs from the Nadi area. So for the people of Nadi, GOPD, general outpatient services and emergency services will be provided from 3 sites: the Sharada Medical Clinic in the middle of Nadi town, the Sharada Medical Clinic in Malolo in Nadi, and the Namaka Health Center in the Namaka area. The special outpatient clinic that used to be held at the Sharada Medical Clinic will be temporarily suspended, and we will notify you, the public, later of new arrangements for the SOPD clinic. The Namaka Reproductive Health Clinic will now cater for expecting mothers for their assessment as well as delivery as necessary. The Nadi Health Center will continue as the maternal and child health clinic for the people of Nadi. All admissions will be referred to Lautoka Hospital or when required to Singatoka Hospital, and the arrangements for COVID-safe transfer of patients and their care at the two facilities will be organized. So for tonight, if you are sick and you live in Nadi, or if there is a mother that's expecting and laboring tonight, the place to go is the Sharda Clinic in town. And for those of you familiar with Nadi town, for those of you who are not familiar, the Sharda Clinic is in Ashram Road. Ashram Road is when you enter Nadi town from the airport end. It is the first road on the right. And the clinic, the Sharda Clinic, is opposite the Farmers Club. So don't go to the Farmers Club, go to the clinic if you need health services. So for CWM Hospital, as you've heard from PS, the team is early in its investigation for the number of cases. Nonetheless, there are parts of the hospital that are now closed to the staff, to the people, while there are parts of the hospital that remain operational and accessible tonight. And they are the maternity services, the ED services, and the children's hospital. The current team in the hospital are going through a rigorous screening and swabbing test the whole of tonight that will cover some 700 plus staff and more than 500 patients who are currently admitted at the hospital. So again tonight, for laboring moms, if you need to come to CWM Hospital, you will come through the normal access that you always come through, via Waimanu Road, straight to the foyer, maternity foyer. You'll be met there by the staff who will direct you to where the maternity team will safely attend to you tonight. If you are sick tonight and needs to come to the emergency department at CWM, you can still access the CWM emergency department through Extension Street, adult or children. When you come to the emergency department, you'll be directed to where there's a team that's already available to look after you and safely treat you, whether you get admitted or discharged safely. We will also advise tomorrow if there are changes to this arrangement. Our messages remain. Wherever you are, you can be confident that you are safe from the virus if you strictly follow COVID-safe measures. Wash your hands regularly, whether you're using soap and water or alcohol-based hand rubs. Wear your mask properly, covering your mouth and your nose. And at all times, if you are out of your home, maintain social distancing of 2 meters and avoid crowds and gathering of people, particularly if they are not from your home or your household. Stay at home if you don't have a good reason to move. Practice correct cough and sneeze etiquette. And keep your Care Fiji app functional by downloading the app into your mobile and switching the Bluetooth on to activate the app. Benawalevu and good evening.